Are you aware that obesity is one of the most significant public health challenges of the 21st century? It's a startling fact, but obesity has become a global epidemic, affecting millions of people worldwide. It's not just an issue of appearance or body image. It's a serious health concern that can have dire consequences. In every corner of the globe, from the bustling cities to the quiet countryside, obesity is on the rise. It's a silent enemy, creeping into our lives, often unnoticed until it's too late. And the health risks associated with obesity are far from light. We're talking about life-threatening conditions like heart disease, diabetes, and even certain types of cancer. This isn't a matter to be taken lightly. It's a call to action, a wake-up call to recognize the severity of the situation and take steps towards a healthier future. So, what are the top 10 things you need to know about obesity? Let's dive in. Starting off at number 10, it's essential to understand what obesity is. At its core, obesity is a medical condition characterized by an excess amount of body fat. This fat accumulation is not just about aesthetics, but it's a health concern that increases the risk of other diseases and health problems. So, how do we measure obesity? That's where the body mass index, or BMI, comes in. BMI is a simple calculation using a person's weight and height. While it doesn't measure body fat directly, it somewhat correlates with direct measures of body fat. The World Health Organization defines a BMI of 25 to 29.9 as overweight, and a BMI of 30 or more as obese. Keep in mind though, BMI is a rough estimate and many factors, like muscle mass, can affect it. It's just one tool in the toolbox to identify weight problems. Now that we understand what obesity is, let's move on to its symptoms. At number 9, recognizing the symptoms is vital for early intervention. The symptoms of obesity are both physical and psychological. On the physical front, an individual may notice a significant increase in body weight. This might be accompanied by fatigue, shortness of breath, and an increased sweating. Other physical symptoms can include high blood pressure, joint and back pain, and trouble sleeping. Psychological symptoms, on the other hand, can be somewhat harder to recognize. They may include feelings of isolation, depression, or low self-esteem. A person may also notice changes in their eating habits, such as eating when not hungry or eating in secret. Remember, obesity is not just about an individual's appearance or size, but also about their overall health and well-being. It's important to be aware of these signs and symptoms, as they can indicate a need for intervention. Recognizing these symptoms is the first step towards addressing obesity. At number 8, what causes obesity? Let's delve into this. Obesity is a complex health issue, and it's not just about overeating. Unhealthy eating habits, such as consuming high-calorie, low-nutrient food and beverages, can lead to weight gain, a key factor in obesity, but there's more to it. A sedentary lifestyle with a lack of physical activity can also contribute to obesity. When we don't expend the energy we consume, it gets stored as fat. And we can't ignore the role of genetics. Some people are genetically predisposed to obesity, meaning their bodies may store fat more readily or they may feel hungrier more often. However, it's important to note that these factors can interact in complex ways. For instance, a genetic predisposition may make one more likely to overeat, especially when coupled with an environment that promotes unhealthy food choices. Knowing these causes can help us avoid the risk factors. By understanding the root causes, we can make informed choices and take steps towards a healthier lifestyle. Number 7, the health risks associated with obesity are numerous. Obesity isn't just about size or appearance. It's a serious health condition that can lead to a myriad of complications. And these aren't minor issues. We're talking about life-threatening diseases that can drastically reduce the quality and length of life. Chief among these health risks is heart disease, which is significantly more common in individuals with obesity. This is due to the strain excess weight puts on the heart, forcing it to work harder than it should. Next, we have type 2 diabetes, a condition that's closely linked with obesity. In fact, obesity is believed to account for up to 85% of the risk of developing type 2 diabetes. Additionally, obesity increases the risk of certain types of cancer, including breast, colon, and kidney cancers. The exact reasons for this are complex and still under investigation, but the link is clear. These health risks highlight the importance of managing obesity. Coming in at number 6, what are the treatment options for obesity? Let's dive right in. The first line of defense against obesity usually involves lifestyle changes. This includes adopting a healthier diet, rich in fruits, vegetables, and lean proteins, and getting regular exercise. The aim is to create a calorie deficit, where you're burning more calories than you're consuming. In some cases, when lifestyle changes aren't enough, medication might be considered. These are not magic pills, but tools to assist in weight loss. They work in different ways, some reduce appetite, others block fat absorption. For individuals with severe obesity, bariatric surgery may be an option. Procedures like gastric bypass or sleeve gastrectomy can drastically reduce the size of the stomach, leading to significant weight loss. Remember, these treatments are not quick fixes. They require commitment and often significant lifestyle adjustments. These treatments can help manage obesity, but prevention is always the best strategy. At number 5, the role of diet in managing obesity cannot be understated. Food is our fuel, and what we consume directly impacts our health and weight. A balanced diet is a cornerstone in combating obesity. It's not just about eating less, but eating right. Choosing a variety of nutritious foods from all food groups can help prevent weight gain. Incorporating whole grains, lean proteins, fruits, and vegetables into your meals is a great starting point. Equally important is to limit intake of processed foods, high in sugars and unhealthy fats. Remember, it's not just what you eat, but when you eat. Regular meal times and mindful eating play a pivotal role in maintaining a healthy weight. Drinking plenty of water and reducing consumption of sugary drinks can also aid in weight management. As with everything in life, moderation is key. A well-balanced, nutritious diet isn't a temporary fix, but a lifestyle change. A healthy diet is key in the fight against obesity. Number 4, physical activity is a crucial part of any obesity prevention and management plan. Regular exercise isn't just about losing weight or building muscle. It's a key component in maintaining a healthy lifestyle. It's like the oil that keeps the engine of your body running smoothly. Physical activity boosts metabolism, helping the body burn calories more efficiently. It also improves cardiovascular health, reducing the risk of heart disease, which often accompanies obesity. But it's not just about the body. Physical activity is also beneficial for mental health. Importantly, physical activity doesn't mean you need to run a marathon. Small changes can have big impacts. A brisk walk, a dance class, or even gardening can get your heart rate up. It's about finding something you enjoy so it becomes a part of your routine, not a chore. Physical activity and a balanced diet go hand in hand in managing obesity. Number 3, did you know that mental health plays a significant role in obesity? Yes, indeed, it's a two-way street. Obesity can lead to mental health issues like depression and anxiety, and these conditions can further exacerbate weight gain. It's a vicious cycle that can be challenging to break. Stress, in particular, plays a significant role. It triggers the release of hormones that can lead to overeating, and it can also disrupt sleep, which is essential for maintaining a healthy weight. Moreover, people dealing with mental health issues may find it difficult to maintain healthy eating and exercise habits. So, what's the solution? Well, managing stress is key. Practices like mindfulness, meditation, and yoga can be incredibly beneficial. Therapy and medication can also be effective for those dealing with more severe mental health issues. Remember, it's not just about the physical. Maintaining good mental health is equally important in managing obesity. Number 2, regular checkups can help detect obesity early. The significance of routine health checkups cannot be underestimated when it comes to tackling obesity. These visits to your healthcare provider offer an excellent opportunity to assess your weight and discuss any concerns or changes you might be experiencing. During a regular checkup, your healthcare provider can measure your body mass index or BMI, which is a critical indicator of obesity. They can also check for other obesity-related conditions such as high blood pressure and diabetes. Regular checkups also allow for a continuous dialogue between you and your healthcare provider, fostering an environment of trust and understanding. This relationship can empower you to make informed decisions about your health and lifestyle choices. Remember, obesity doesn't happen overnight. It's a gradual process that can be halted and even reversed if caught early. So, make regular checkups a part of your health routine. Early detection is key in managing obesity. And finally, at number 1, prevention is the best cure. Imagine a world where we don't have to treat obesity because we've prevented it from occurring in the first place. This world can be a reality. How? It starts with a balanced diet. Consuming a variety of nutrient-rich foods and limiting intake of empty calories can help maintain a healthy weight. Next, let's not forget the importance of regular physical activity. It's not just about losing pounds, it's about strengthening the heart, boosting the mood, and improving overall health. And then, there's the role of regular checkups. These can help identify potential health risks early on, allowing for swift intervention before obesity takes hold. Lastly, good mental health is crucial. stress, anxiety, and depression can lead to overeating and weight gain. By addressing mental health issues, we can tackle obesity from another angle. Remember, prevention is always better than cure. With these preventive measures, we can fight obesity before it even begins. To summarize, obesity is a serious health issue, but it can be prevented and managed. It's a growing epidemic, but understanding obesity is the first step towards tackling it. We've recognized the symptoms, which are crucial for early detection, and explored the causes, which can be varied but often involve lifestyle factors. We've delved into the health risks, painting a stark picture of why obesity is a battle worth fighting. We've discussed the role of diet and the importance of physical activity, both of which are essential in managing weight. We've also underscored the role of mental health, reminding us that our emotional well-being is tied to our physical health. Regular checkups are a must, for they can catch potential issues before they become major problems. We've highlighted the power of prevention, because it's always better to prevent than to cure. With the right knowledge and actions, we can fight obesity and live healthier lives.